Welcome back. You know, February is Heart Health Awareness Month. It's a great time to discuss how to prevent heart disease and also be heart healthy.
Yeah, absolutely. But who is at risk? What are the signs of a heart attack? Here with answers to help you understand your heart and more, please welcome Director of SignatureCare Emergency Center, Dr. Garcia. Welcome, Dr. Garcia.
Thanks for having me.
Okay, so a lot of people, wonder, as they age, does their risk go up? What are some of the primary risk factors that would contribute to a higher risk of heart attack?
So age is certainly a risk factor. 65 and up, we're certainly concerned about smoking, high blood pressure, diabetes, obesity to a certain extent.
So if someone wants to reduce their risk, they could lose some weight, exercise more, stop smoking.
Yeah, I think good heart health starts and ends with a good diet. Fresh fruits, vegetables, lean meats, try and avoid the red meat, that sort of thing.
And really shopping, I guess, from the perimeter of the grocery store,
Absolutely,
right? Sticking to those as opposed to the aisles. Let's talk about some of the warning signs. And I always think this is very fascinating when we're talking about symptoms for a heart attack, because it can emulate other symptoms. I mean, even nausea can be one of them, right?
Certainly. So the symptom we're most concerned about is angina, and that's heart pain. And what people typically describe is a pressure-like pain in their chest. I've even had patients say, I feel like an elephant sitting on my chest, And this pain can move from like the arm to the arm up to the jaw. People sometimes describe nausea, dizziness, palpitations, profuse sweating. And it usually starts when you're kind of exerting yourself, doing something strenuous, climbing the stairs, that kind of thing.
Okay, so doctor, if someone is experiencing these symptoms, what is the first course of action? What do you guys recommend?
Best thing to do, if you're concerned about your symptoms, get yourself to an emergency room. Take an aspirin, it can't hurt. And if you have high blood pressure and haven't been taking your medication, take your blood pressure medication.
And what's great about SignatureCare ER is that some people might hear this and think, okay, clinic, not the best place to go for a heart issue, and that's not the case. I mean, that's a great spot to go.
It's we're certainly very equipped to take care of this kind of problem. We can do pretty extensive heart testing. Even keep you there for long periods of time. Have cardiologists come in and see you. So yes, a very good place to come for these kinds of symptoms.
And so when people come into SignatureCare Emergency Center, you guys, the first thing you would do is do an EKG, right?
That's right. Yeah, the EKG is the first thing we do, and it gives us a pretty immediate picture of the heart and tells us if there's something that we need to do immediately and involve the cardiologist. It tells us if you're having a massive heart attack. Sometimes it's not so straightforward. Sometimes there's some more intricate decision-making involved. But yeah, it's a very important piece of information first off.
But if you guys, after the EKG, if you guys think that there is like a bigger issue, the patient can be sent off to the cath lab, right?
That's right. And a cath lab, if we notice this kind of massive heart attack on the initial EKG, we send people to a cath lab. And it's a very, very specialized area of a hospital where these specialists can use non-invasive tools to open up the vessels in your heart. Yeah, very interesting.
And doctor, there's also some patients that really don't have symptoms, and then you end up saying you've had a heart attack.
Right, yeah. We call this atypical angina, or colloquially it's a silent ischemia or silent MI. And it's less common, usually in like 2% of the heart attacks that we see, but these folks usually have other problems like diabetes and that sort of thing.
Okay, let's move on and talk about stroke for just a moment. What essentially is a stroke?
So a stroke is a brain attack, and I say that because it's a similar problem to a heart attack. It's just in a different part of your body. In the case of a heart attack, it's an issue of blood flow through the vessels of your heart. In the case of a stroke, it's an issue of blood flow through the vessels of your brain. And as a lot of people might know, there's no pain associated with a stroke. Usually, people are having problems with speech, one-sided weakness, disorientation sometimes.
But even that, sometimes the slurred speech and the one-sided weakness there are stroke patients that don't have that either.
Certainly, yeah. It can be a confusing presentation. It can be, yeah.
This is really interesting. You brought up a study when we were chatting backstage about if you've had the flu or you have the flu, the correlation to perhaps having a heart attack is pretty great.
Yeah, great study out of Canada, a group of cardiologists there. just did a study that shows a very high correlation, like 6 times more likely to have a heart attack if you have the flu. Very interesting.
And that really, Doctor, underscores the need to get the flu shot,
Absolutely.
right? Because people,
Yeah.
I mean, you can't sequester yourself from the flu. That virus lives for days. It's on doorknobs and chair arms, everything we touch, right?
Sure, yeah. It's unavoidable. Good hand washing, get vaccinated, especially if you have, these other medical problems.
And we should mention, you can still get vaccinated. It's still a good time
Absolutely,
to get
yeah.
that.
The CDC is still recommending vaccination. Yes, ma'am.
And let's talk about the locations for SignatureCare ER, because you are citywide.
That's
so
right.
You have several locations.
Courtney's been to most of them.
Only one, the Heights. My whole
3
family,
times.
we've been there. And here's a map of all the locations nearest you. And you said you're in the one in Stafford.
Stafford.
Yeah,
So there's Stafford, Montrose, Memorial, the Heights, Sugarland, and coming soon to the West Chase location.
That's right. Yep.
All right. Well, Dr. Garcia, thank you so much for stopping by. Really interesting. For more info, or if you would like to find the location nearest you, you can visit ercare24.com. Thanks so much.
Thanks,
you.
Doctor. Appreciate it. Well, are you tired of trying to cover up or hide under eye bags